Kelly. Just wanted to take a moment to thank you for teaching in the Introduction to Clinical Reasoning course, and to let you know that if you have any questions or concerns, you can reach me, the course director, Steve Durning, or my administrative assistant, Miss Darrell Edwards, in room A3068. I wanted to take a couple of minutes to just orient you to the packets that you will be receiving when you come and teach in the small groups each day. The first page that I wanted to point out is the grading sheet. Now, the grading sheet is undergoing revision this year. What we want you to do is to take attendance of each student. Please mark that on the form. If a student is absent, just write A. We will find out the reasons why they're absent. Your groups will be comprised of anywhere between 5 and 7 students, and it's important to point out that you will only have 70 minutes for each small group session, as opposed to 90, which we had last year. And wanted to also point out where you write your comments is right underneath each student's name. So simply put your comments underneath each student's name, and we would be happy to provide you with additional comments to help you with what we would call high quality comments for the course. The next form that I wanted to point out is the small group grading sheet, which comes on a separate colored piece of paper. It should be a blue piece of paper in your packet. And to point out that we have video examples to help you with what we mean by each of the different small group grades, which are absent, bystander, observer, participant, and editor synthesizer. And we thank you for making those comments to help us. Here's your packet. So you're going to be famous now. You're good with being famous? Sure.
For anything. Sir, it sounds like this guy may have unstable angina. It seems like his chest pain's been getting worse and worse with less and less activity, just by the definition. Sir, just from what we've been talking about, it sounds like that has CHF from his JVD, the rails, crackles, edema, all the classic symptoms of CHF, but he also has this hyperkalemia. What do we do with somebody that has these symptoms and we really can't use Kxalate because of the increased water load and worsening his CHF?
Hey, so what do you think?
Me? What do you say?
Another important form in the packet is our small group teacher guide. A couple of points that I wanted to make here. First and foremost is make sure that you review the key teaching points which your section leader will provide for the session. Those are the points that we want you to cover in each session. You can cover all kinds of other points as you wish and as time permits, but make sure that you cover those essential points which will be tested. Ask the students to identify the pertinent findings. Don't ask them to merely read the cases, but ask them to synthesize what's in the cases and using correct terminology. When you're actually teaching, make sure you think aloud. Students are new to the reasoning process as second-year students, and it can be very helpful if you vocalize your thoughts as you're going through them. Pretend you don't have a frontal lobe. Teach general principles and prototypes. Students need to know what's common. That's what we're stressing in this course, as opposed to what's uncommon, atypical. That being said, it can be very beneficial to ask what-if questions, where you actually change a key feature in the case, which makes it a new case to the student, and then point out how that new key fact changes the diagnosis and potentially the management plan. And again, we are emphasizing the diagnostic step in this course as opposed to the management step in this course. It's important to teach and discuss multiple concepts, the key concepts, multiple times in multiple ways. Again, these are new learners, and it's very helpful to review as you go through the discussion. It can be very helpful to use Blackboard, the Blackboard that you'll have in the room, as well as other AV aids. We encourage you to bring photos, talk about particular patients, and use the Blackboard to help the students with reasoning. And compare and contrast related diagnosis. Do this out loud to help students. They are just learning about each disease in isolation, and your expertise in terms of how, for example, heart failure contrasts with pulmonary embolism or acute myocardial infarction, and how each of those diagnoses can sometimes present simultaneously and how you might recognize that would be very helpful to our students. Again, there are more key teaching points in the small group teacher guide that you can look at. We'd be happy to discuss that more with you as you see fit. The final form that I wanted to point out is just the ICR course feedback form. We are very interested in hearing what you think about the course and how we can improve things. We're particularly interested in any problems and suggestions of improvement, as well as strengths that you have for the session you taught in. Again, thank you for taking the time to teach in ICR, and we look forward to seeing you soon.
Okay.
Thank you.
Hi, I'm Lou Pangaro. I'm the chair of medicine at USU. I understand that you're going to be helping us in the ICR, the clinical reasoning course this year. Thank you very much. There's nothing we do that's more important than helping students in their clinical reasoning skills, so we really appreciate what you're doing. If there's anything I can do for you, let me know. Thanks.